Courtney, a therapist here at Transcend. The purpose of this video is to go over some important things to remember in preparation for your first infusion. Before you come into the clinic, please remember to go ahead and line up your ride for after your infusion is completed. Please do not eat 3 hours prior to your appointment time. It's okay to continue drinking water during this time. It's best not to have anything that is stimulating, such as caffeinated tea or coffee, prior to your session. If in the intake appointment the provider told you to hold any medications, please do not take those specific medications that you were asked to hold. Otherwise, please take all of your medications as you would normally. After your session is over, you may not be in the headspace to take care of anything important. If there's anything you can get out of the way now, such as emails, work tasks, please do so prior to the appointment so that you can have time to rest and recuperate after the session. Now I'll review some things that are important to know for your first ketamine-assisted psychotherapy session. These are like your pre-flight instructions that you get before taking off on an airplane. You may be nervous, and that's to be expected. Every person we see at Transcend has been nervous, at least to some degree, before the first infusion. It is natural to feel anxious when entering a new situation or experience. But remember, you are in good hands. Every day we help people through this process, time and time again, despite having those anxious feelings. We will be right by your side every step of the way. Throughout our experience in supporting clients, it seems to be most helpful to go into the first infusion with the intention to be curious and to be as open as possible to fully experience whatever may intrinsically arise today. So try to take the pressure off of yourself from trying to do too much with this first session. If all we do today is guide you through your first experience, show you what that experience is like, and learn about your ketamine sensitivity, that is mission accomplished. If therapeutic content comes up, this is great, but is generally considered extra credit for today. So for today, just focus on relaxing fully into the experience, exploring it, and keeping an open mind. Next, we want you to know that you have control over the level of the experience. During the experience, we will be checking in every few minutes and asking specific questions to help determine the level of the experience you are in and adjusting accordingly based on your comfort. If at any point you feel overwhelmed, we can lower the level of the experience or stop at any time. If we adjust the level of the experience, it only takes about a minute or two for the change to be felt, because ketamine is very short-acting. We will always keep you at a level in which you will be able to talk to us. For some people, it can feel strange to talk under the effects of ketamine, but you will be able to do so. Now let's talk about timing. When you arrive, a medical provider will bring you to your room, get you set up to the monitor, and start a small IV. If you have ever had issues with passing out during IV starts or any other concerns, please tell the provider. This is a good time to ask any lingering questions you may have for the provider. Next, your therapist will meet with you for about 15 to 20 minutes prior to starting the experiential portion of the session to discuss emotions or thoughts that may be arising in anticipation of your first infusion. The therapist will also often outline breathing techniques, grounding exercises, or other general relaxation techniques to assist you in the experience. Once you and the therapist are ready, the medical provider will return to the room and start the pump. When we start the pump, you will start noticing the first effects in about 2 to 3 minutes. From there, the experience will slowly build until you're at a level that we typically work with in KAP. Most people will be fully in the experience at around 10 minutes, so there's plenty of time to relax into it. Once you're at a therapeutic level, we will level it off for around another 20 to 30 minutes. About 50% of people talk with the therapist throughout the entire infusion, and the other 50% journey quietly within themselves. Once we stop the infusion, you will begin to return to normal consciousness, which usually takes around 10 minutes for most people. Once you are down from the experience, the medical provider will take you off of the monitor, take out your IV, and leave the room, but will remain available for you if there is anything you need. Most people will continue to speak with their therapist for around 45 minutes after the experience is over to discuss the experience and continue the therapeutic process. Some other things to know. You will be medically monitored during the entire ketamine infusion. Sometimes medical monitors and pumps beep. Do not be concerned with any beeping you may hear, as it doesn't mean anything is medically wrong with you. If you ever do feel concerned, just ask. That's what we are here for. Most people go through the KAP process wearing eye shades. Some people may feel claustrophobic in eye shades and prefer to have their eyes closed. As much time as you're able to have your eyes closed or in eye shades, the less likely you are to become nauseous during the infusion. If you ever do become nauseous, the medical providers are prepared to administer nausea medication at any time, if that's needed. If you need additional time to recover after talking to your therapist, we have a decompression room for you to take as much time as you need. We provide eye shades, music, and the option for a weighted or unweighted blanket. But you may bring personal items such as your own eye shades, a blanket, a journal, or other comforting items. And don't forget to dress comfortably. We hope that you have a great first session. We will call and check in with you the day after your session. If you have any questions or concerns after your session prior to us reaching out, call 1-833-731-3400 and we will get back to you as soon as we can. Lastly, we will leave you with this. May you be open to fully feel whatever arises. Take each moment as it comes. Dive deep within yourself and explore. Be curious. Try to let go as much as you can. If things get challenging, just remember to breathe. Your breath will always be there and will guide you through. And remember, we will be with you, right by your side, the whole way through.